Today, we will be taking a closer look at TBIs, or traumatic brain injuries.
TBI is a life-altering experience that can affect a person's occupations, participation, and health. Survivors of TBI may show a variety of problems because the range of disability is more varied than in other central nervous system dysfunction. No two clients present with exactly the same symptoms, even if they have common diagnoses. Let's take a closer look.
Traumatic brain injury is a leading cause of disability globally. In Canada, TBIs affect people of all ages, genders, and walks of life. 2% of the population lives with a TBI, and there are 8,000 hospitalizations for TBI each year, as well as at least 200,000 concussions. Some of the most common causes of TBI are motor vehicle accidents, falls, assaults, intimate partner violence, and sports or recreation. Additionally, indigenous populations and those who are homeless or incarcerated are especially vulnerable.
Brain injuries may be open, involving penetration of the skull and meninges, or closed, where the skull remains intact, or they may arise from deceleration, resulting in diffuse axonal injury. Neurons in their synapses shear, stretch, and tear due to abrupt changes in momentum. Related symptoms will depend on the location, type, and severity of the injury, as well as other complicating individual factors such as comorbidities, access to medical care, age, etc.
Primary injuries, whether open or closed, include localized contusions, contralateral contusions, as in coup contre coup, and diffuse axonal injury. Secondary injuries result from a series of chemical reactions in the brain that can occur immediately after the injury or even days later. This includes intracranial hematomas, cerebral edema, raised intracranial pressure, hydrocephalus, intracranial infection, and post-traumatic seizures. These injuries constitute medical emergencies and are responsible for the majority of TBI-related fatalities.
When someone with a suspected TBI comes into the hospital, medical professionals act quickly to classify the patient's level of severity. There are 3 recognized classifications of TBIs: mild, better known as concussions, moderate, and severe. 3 measurements are used for diagnosis: level of consciousness, which is the amount of time the individual is not awake or alert; post-traumatic amnesia, which measures how long the individual was in a state of confusion; and the Glasgow Coma Scale, which measures things like when the patient first opens their eyes and has a verbal and motor response. These are the diagnostic criteria for severity of TBI. As you can see, severity of TBI correlates with decreased GCS score and increased amount of time experiencing loss of consciousness and post-traumatic amnesia.
Regardless of the diagnosis, brain injuries almost always result in cognitive impairments. Some of these impairments include a deficit in all areas of attention, orientation, and memory, as well as delayed reaction times. All of the symptoms impact executive functioning, making it hard to plan, sequence, and execute functional tasks or meaningful activities. People with all types of TBIs often complain of dizziness, balance issues, fatigue, headaches, nausea, and sensitivity to noise and light.
If a person has a suspected concussion, they should stop participating in their usual activities and see a medical professional as soon as possible. They should also monitor for delayed symptoms for 48 hours. During this period, people with concussions will need to rest, allowing the brain time to heal. It typically takes 2 to 4 weeks to recover from a concussion. Unfortunately, new symptoms may appear, or old symptoms may reappear and worsen as new activity levels are introduced. If this happens, it is essential to return to a lower level of activity that does not affect or bring on new symptoms. The goal is to not trigger or worsen symptoms. Once symptoms start to improve, the individual can begin to gradually increase activity levels in hope of returning to work, sports, or school.
Because concussion signs and symptoms present similarly to many other conditions, without proper care, patient can suffer irreparable consequences. If managed correctly, a concussion should not impact someone's quality of life. However, people who experience frequent concussions, like athletes, are at risk of chronic impairments. Caregiver can refer to the CAT online website, which offers useful guidelines on what to do for individuals with mild TBI.
Now let's take a closer look at what happens when the brain injury is more serious. More severe traumatic brain injuries introduce more complex issues involving sense, emotion, and sleep. Patients may experience hypersensitivity, dulling, or a complete loss of sensory function. Distressing emotional changes include depression, anxiety, irritability, and even aggression. Patients may also have difficulty regulating cycles of sleep and wakefulness, as well as developing sleep apnea.
A defining feature of the severity of TBIs is the impact on physical or motor function. People with moderate to severe TBIs face many unique challenges during their recovery, the most notable being a change in muscle tone and voluntary movement, which might look like stiff, rigid muscles or extreme weakness. This abnormal tone affects posture, mobility, fine motor movements, and even swallowing. TBIs in the lower brain area can trigger abnormal or primitive reflexes, which can further interfere with an individual's mobility and functional success in their daily tasks. Injury to the cerebellum can result in ataxia, or reduced coordination and balance. Injuries further down the brainstem can produce a profound loss of motor ability that results in decorticate and decerebrate postures, rigid and involuntary positions that are an indication of severe damage.
Moderate and severe TBIs pose an extreme and immediate threat, and patients will need to remain in intensive or acute care until they stabilize. Up to 50% of severe TBIs will not survive the secondary effects of their injury. Once they have regained consciousness and been clear of rehabilitation, they will begin working with their multidisciplinary health care team, which includes both physiotherapy and occupational therapy. The team collaborates to help prevent muscle weakness, skin breakdown, and permanent shortening of muscles, while also helping the patient progress towards sitting independently, walking, and getting back to their meaningful activities.
The brain is a complex and fragile organ. We as a society are just scratching the surface as to the wonders of our minds. However, even within the last 10 years, scientists have made significant gains in traumatic brain injury knowledge. Our healthcare system is much more equipped than ever before to provide the best care for people with traumatic brain injuries. However, we can all do our part to lower our risks by obeying safety guidelines and practicing basic fall prevention.
Thanks for listening!
If you found this video interesting, have a look at our references for more information.